are here, and they're going to share their thoughts with us. But first, with all the focus on the coronavirus, there is concern that we've lost focus on the southern border and illegal immigration. Our government has been focusing on keeping America safe during the pandemic, which makes sense. But have they neglected agents at the southern border? And is the lack of attention making it easier for people to get into the country? The numbers haven't been released, but some are saying hundreds of agents and illegals have the virus on the southern border. And towns like Laredo, Texas, are being extra careful to keep the virus from crossing the border. At the same time, ICE is releasing 700 prisoners due to coronavirus concerns. All the while, Democrats are asking President Trump to stop building the wall and move all that money to be used for health care. On top of that, 44 migrants tested positive with coronavirus who were shipped back to Guatemala. And just today, the Washington Post is out with a story that smugglers sawed through President Trump's border wall 18 times in 1 month in the San Diego area. It's crazy. Well, to help break this all down, we've got the number 2 person at the Department of Homeland Security, the acting the Secretary of Homeland Security, and the former Attorney General of Virginia, Ken Cuccinelli.
Good to be with you, Sean.
Good to be with you. Thank you. So before we get to illegal immigration, let me ask you about this report from the Washington Post today. It says that smugglers sawed 18 holes into the border wall in the San Diego area in 1 month, and in one case, they said that it happened 5 times in a day. How does something like that happen?
So actually, it demonstrates the value of the wall. It's obviously a clear impediment to smugglers, be they human smugglers or drug smugglers. And there is a little bit of a cat and mouse battle that goes on between the Border Patrol agents and the evil folks on the other side who are trying to break our laws. And cutting through the wall is just one aspect of it. Obviously, that's not easy for them to do. Doesn't mean they don't do it. And we go and fix it. You noted 5 times in a day. So some of that does go on. But I would suggest that it demonstrates why it's important that President Trump built the wall we have and continue with the goals that he has set out to build another several hundred miles of wall even before the end of this year, because it is blocking their way. It keeps them from doing what they want to do. And I should add, it keeps our agents and our country safer.
You mentioned the agents, right? Whether it's ICE agents or CBP agents. There's a lot of reports that I just mentioned are coming out that talk about a lot of these agents coming down with COVID-19, growing concern about their safety. What's being done to protect them? And because of the virus, are we ensured that we have enough people at the border to make sure that we're not creating a porous border?
So there are people that get through every day. Our estimate is in the hundreds. And we're operating under a CDC order at the border right now that allows us to do very quick repatriations, primarily to Mexico, because the vast majority of people coming across our border right now illegally are Mexican. And we're catching 400 or 500 of them a day. There's probably another several hundred that are getting away. And that's obviously a significant public health concern. And in terms of the agents themselves, you see pictured the use of protective equipment like gloves and masks and so forth. But there's only so much protection you can get in a law enforcement capacity when you've got to actually lay hands on people to do your job. And so that's part of the importance and the significance of having that CDC order in place. So less of the people we're apprehending are coming into these stations, which, as you know, Sean, are not prepared for medical quarantining. ICE is prepared for quarantining, but CBP border stations are not set up for that. And so it's a greater danger to the migrants themselves and to our agents. So having that CDC order and getting it extended for a good period of time are very high priorities for DHS to keep our own agents safe. And frankly, the migrants who we have to contend with are better off and kept safer with the process we're using today versus if we did not have those sorts of quick repatriation options that don't require the use of essentially storing people in facilities where the virus, if present, could spread easily.
Tim, we only have 1 minute left, but this week ICE released 700 immigrants. Is there concern that there's right now 34,000 immigrants in detention in centers? How many more are going to be released at this point?
Yeah, so let me be clear that the reporting you're relying on there is a little bit inaccurate. There have been 693 releases over the course of the entire last month up till last Friday by ICE. And the basis of these are people who were over 60 or 70 and had other medical conditions who we know statistically, if they got the virus, were much more likely than you or me to die. And we don't want that to happen in our facilities. Those releases are from a peak of 37,000 people, most of whom have been repatriated to get us down to the 34,000 number. So that's less than 2% of our total population. We don't have any plans for some sort of continuing release. We review each case, meaning each inmate, individually. But I think you've seen the vast majority of the COVID-based releases from our existing population that are going to happen.
Mr. Secretary, thanks for joining us, and thanks for all the work that you and your department do to keep us safe.
Glad to do it. Thank you all.
Thank you very much.